Arts in Washington. Thank you so much. Greg.
You know, we hear a lot these days about the ferocious debate between Democrats and Republicans over the health care reform, but a third element is actually driving Washington policy and debate to some extent. The lobbyists, they're ever present. In many instances, the so-called special interests are working intensely behind the scenes to preserve the current system, a system that President Obama is vowing to alter.
By attacking waste and fraud within the system, it will slow the growth in healthcare costs without adding a dime to our deficits.
All right, so who is going to ultimately win this battle as we move forward? Joining me now, fair and balanced debate, Oklahoma Congresswoman, Republican Mary Fallin, who serves on the Committees on Transportation and Infrastructure and former advisor to Hillary Clinton, Jim O'Green. Thank you both. Representative Fallin, you know, citizens and businesses alike do have a First Amendment free speech right to lobby members of Congress on pending legislation. The Supreme Court has said you're entitled to do that. As a member of Congress, how have those folks, lobbied you, and how has that shaped any of the proposals now in front of you?
Well, I think it's been a very good public debate that we've had on health care reform. I've been thrilled that so many people have actually engaged in the health care debate, because we're talking about 16% of our national economy. We're talking about people's personal health. And, of course, with the bills that are being debated in Washington, D.C., we're talking about the possibility of a massive new federal government program, possibly new tax increases that have been included in some of the legislation. Yeah. And we're talking about limiting patient choice. So I'm excited that so many American people are actually coming to the town hall meetings, that are writing their congressmen, that are getting involved, and certainly lobbyists and other healthcare organizations are actively talking to various groups too.
Well, they surely have, and they've been dropping a load of cash too. Ms. Green, President Obama is applauding the bill set for a vote next week in the Senate Finance Committee. Is that a bill? I mean, It is a bill, is it not, that has been in part at least shaped by lobbyists, and thus didn't to some extent those lobbyists, at least in the words of Congressman Jim Cooper, your colleague, who, by the way, teaches health policy, didn't those lobbyists win?
Well, definitely, ideally, it would have been a transparent health insurance reform process. But I think instead we've been subjected to what some could call a morally suspect, definitely record-breaking lobbying blitz by the insurers, the hospitals, and other major sectors to influence these members of Congress to make sure that they maximize their profits and really also maximize the 46 million new customers that they could be getting. Now, I think that if you look at just the raw numbers, it speaks for itself. There are 6 registered lobbyists for every member of Congress. That's 6 registered health care lobbyists for every member of Congress. And they have been fighting so hard against the public health insurance option. I think that that's a clear sign of why it is very important to the American people to have a public health insurance option included in this bill.
Well, unless they have a point that it will drive out private insurers by creating essentially a government monopoly. But Representative Fallin, over to you. The Finance Committee bill, which seems, by the way, to have the most support, we've been doing the numbers here, that's still going to leave anywhere between 17 and 25 million Americans without any insurance. I mean, that is certainly an improvement, but it is a far cry, is it not, from universal coverage? And so the question is, you know, what's the point? The remaining uninsured will still drive up the cost of health care because taxpayers invariably are in the end going to have to foot the bill for the uninsured one way or another.
Well, first of all, the number of uninsured people in America is still under question. There's been different estimates that the number may be much less than the 47 million that has been given out. But you talk about the number of lobbyists per congressman. I have to tell you that I had one big town hall meeting in Oklahoma City, and I had almost 3,000 people show up. So it'd be like 3,000 lobbyists coming to see me that were saying, we don't want a federal government take over the health care system. We don't want our taxes increased, and we're very very concerned about the elimination of a free market system to where patients have choice. Now, there are other ways of reforming health care by allowing people to keep their health insurance when they change jobs, looking at issues like eliminating pre-existing conditions, tax deductibility of health care, and as I saw in your previous segment, tort reform, medical malpractice reform. That is one key central ingredient that is missing from the House bill, and I think even from the Senate bill, that will help lower costs.
Ms. Green, the president insists whatever he signs will not be a tax on the middle class, and yet the proposed penalties in all of the 5 different bills, all of those penalties will be assessed against middle-class citizens. They'll be collected by the IRS, which, as you know, collects taxes. Isn't it true these penalties are nothing more than taxes on the middle class?
Well, I think anyone would agree, just as we are required to have insurance on our cars, that it should not be that big of a leap to have insurance on ourselves.
Wait a minute. You don't have to have a car.
As Congressman Fallin said,
for 7 years here, and I never had a car. I didn't have to have a car. To breathe air, I've got to have health insurance, which means I got to pay a tax.
Well, if you'd let me finish, as I was saying, 16% of the U.S. economy is being spent on health care right now. And our businesses, our small businesses, our big corporations are being held hostage by their health care costs. And if we do not do something, this is where I absolutely agree with the president. Inaction is not an option. And whether it's 47 million or 42.5 million, in looking at the numbers that Congressman Fallin was talking about, there are millions of Americans who don't have health insurance. There are millions of businesses suffering under these costs.
If I don't get insurance and I get a penalty, isn't that a tax, Ms. Green?
Well, I think, again, every tax-paying American, is already paying $1,000. We're already paying $1,000 to cover the people who aren't insured anyways. You pay that $1,000 on average every year to cover uninsured Americans. Are you happy with that? I don't think anyone is happy with having to pay for uninsured Americans, and it's time that we have a comprehensive solution. We cannot let these insurance companies run this debate, which they have. $380 million have already been spent. $1.4 million they're spending a day. So that's, again, why we need a public health insurance option.
I would agree that insurance companies have been running the debate, but also Democrats have been running the debate in a nonpartisan way as well. I'm sure you would agree. Jimmo Green, Representative Mary Fallin, thank you both.
Thank you.
All right. Well, the U.S. and Israel